हाँ जी, good evening. कैसे हैं आप सब? I hope that you all are doing good. Now, with me today, we have Dr. Vineet sir, Dr. Deepa ma'am, Dr. Amit Gupta sir, and me myself, Dr. Kunal. We on the Miss channel, we have come in front of you because of a reason that the exam has been postponed, created a lot of stir. So the exam now has been postponed for 20th of January, and because of all that which you are facing, we have come alive and we are here to share the most important thing, that is what to be done in the next 60 days so that we win on 20th of January. So welcome sir, welcome ma'am.
मेरे प्यारे बच्चों, dear loving students, how are you feeling? Exam is postponed. Everyone is talking. Exam is postponed, postponed, postponed. What is the meaning of word postponement? This is not the first time an exam is postponed in our life. There had been many occasions when we were doing our graduation in our respective universities. Some of the exams might be postponed. It happened with me also when I was in final professional exam of MBBS. My final prof exam was postponed. Suppose you are getting married, you are engaged, and the astrologer just rings your father. You can't get married at this date, and you have to postpone the marriage. भैया engagement हो गई, शादी postpone हो गई. You were about to marry on 4th of December. अब शादी की तारीख पंडित जी ने निकाल दी 21st of January. Now your wedding date is 21st of January. Now what will you do between 4th December to 21st January? Every day you will be roaming around with your fiancé, you will be having lunch, you will be having dinner, you will be roaming around at various places. घूम रहे होंगे ना? क्या कर रहे हो? पूरी शिद्दत के साथ, पूरे जुनून के साथ उसी को पूरा कर रहे हो जो आपकी शादी होने वाली है 21 जनवरी को. So if your engagement is postponed from 4th of December, your marriage is postponed from 4th of December to 21st of January, what you will be doing between 4th December to 21st January? Same we have to apply during this time. First of all, let's understand, beta, this is 60 days from now and we have 19 subjects to do. 19 सब्जेक्ट पढ़ने 7 दिन में 60 days 19 subject. We were thriving, we were gasping, we were almost on the ventilator of studies and revision just 2 or 3 days before. Sir, याद नहीं हो रहा. I still remember this mobile was flooded. More than 500 messages. I could not even answer to each and every student. Sir, याद नहीं हो रहा. Sir, not able to remember. क्या होगा? Sir, मैं पास हो जाऊंगा. One student message that I have joined MIST for the first time and this is my 9th attempt. MIST मैंने पहली बार ज्वाइन किया लेकिन मैं FMGE एग्जाम 9th टाइम दे रहा हूं. मैं पास हो जाऊंगा ना? Sir, I am scoring 70 out of 100, 76 out of 100, 83 out of 100 in these tabs. Then I told him, many other students are scoring only 40 or 45 or 46. You are scoring 80, 75, 76. हम ये बातें कर रहे थे कि मैं पास हो जाऊंगा ना. God is kind enough. Take it like this, you know. हमारी तैयारी कभी भी पूरी नहीं होती. It's not about this FMG exam only. It's about life also. If we are completing any task, if we are targeting any task in our life, we are never complete, you know. हमारी तैयारी तो कभी पूरी नहीं होगी. शादी वाले दिन भी लगेगा यार वो वाले रंग की शर्ट खरीद लेता. I would have bought some this kind of sherwani, this kind of suit with me. So we are never done. 60 days, 19 subjects. If you divide, we don't have more than 3 days. We don't have more than 3 days. There are major subjects also, you know, the super 4 of medical science, medicine, surgery, obs, gynae, PSM. This is the golden opportunity to make these super 4 of medical science, medicine, surgery, OBG, PSM our own. All 19 subjects are important. We have to study all the subjects. But many students were thriving. Sir, ये major subject है ना, थोड़ा सा इनमें ऐसा लगता है छूट गया. There are some topics, there are few topics which we don't remember properly क्योंकि topic बड़े हैं ना, पढ़ना ज़्यादा पड़ता है. So this is not the first time an exam is postponed. And many students had a confusion. Sir, our FMG exam is postponed. Is it the last FMG exam? We are nobody to say unless there is an official announcement. But let us share one thing with you. Many other exams which were not related to medical exam, like civil services examination, they are also postponed, which were about to held on 4th of December. तो बेटा बहुत सारे एग्जाम पोस्टपोन हो गए. हमारा एग्जाम पोस्टपोन हो गया, इसका मतलब ये नहीं है कि हमारा लास्ट एफएमजी. जब तक कोई ऑफिशियल अनाउंसमेंट नहीं आता, कोई कुछ भी नहीं कह सकता, लेकिन इसका गलत मतलब नहीं निकालना चाहिए. लाइफ हैपन्स, ये तो जिंदगी है. अनएक्सपेक्टेड होता है, अनकॉल्ड फॉर हो जाता है, लेकिन जो शिद्दत से टिका रहेगा, स्टेइंग विद द ब्रेकिंग दैट प्रोड्यूसेस द विक्ट्री. इस वक्त पे हमको इन 60 दिन में अपना बेस्ट प्रोड्यूस करना है, अपने आप से कंपेयर करना है. अगर 4 दिसंबर को एग्जाम होता तो हमारे मार्क्स कितने आ रहे थे? Suppose we were targeting somewhere around 175 or 180. Why can't we target 200 or 205 by making additional use of these additional 60 days? इन 60 दिन को थोड़ा और अच्छे से यूज करके अगर 175 आ रहे थे तो 210 आ सकते हैं ना बेटा. थोड़ा ऐसे कोशिश करते हैं, थोड़ा ज्यादा पढ़ते हैं, थोड़ा शिद्दत से पढ़ते हैं और कंसंट्रेशन से पढ़ते हैं.
I think very well said by Amit sir that he gave a wonderful example uh, of engagement and marriage. So suppose 4th of December was the proposed date of marriage, but now it is scheduled for say 21st of January. That is, he's trying to correlate 20th of January is your exam, right? So 21st of January is the marriage date.
Yes.
That means 20th of January,
Yeah.
basically that relationship is also focusing on the relations, how to smoothen those relations between 4th of December and 20th of January. So that is what we are supposed to do at this stage of also, because I personally feel, and we actually, all the faculties at MIST, we feel that this is the time when many of the students might lose the momentum and they might deviate from their focus. But please remember what Amit sir rightly pointed out, that if you were targeting say 170, 180, why you cannot target 205 or maybe even more than that? And in this period, the biggest confusion, the biggest dilemma which is going on in our minds is what we are supposed to read now. So the complete faculty team of MIST, the core team of MIST have carved out a well-devised study plan for 60 days. Again, what we are supposed to do right from getting up in the morning to sleeping in the night. That each day we have to stay focused, we have to push the momentum once again, and we have to score big, because this is going to help us not only in the FMG exam, but another exam coming up soon after the FMG. You will get an impetus for that exam also. So have that faith and belief in your self. And I would like to tell you, beta, that this same exam, earlier it was scheduled for 17th of December. It was preponed to 4th December. Now it is repostponed to 20th of January. Who knows? Sorry, there might be another twist in the tail, and they might even shift the date, maybe a preponement or postponement or whatever. So these are something which are not in our hands. But what is in our hands is the preparation. So let us stay focused with our preparation, and let us be ready that even if the date prepones suddenly, then we are not going into a state of shock. So let us keep that momentum going on. And I would like to request Kunal sir to just tell us that how each day has been divided.
So guys, we have tried to give you the plan in the last 60 days, and we want you to get up at around 7 a.m. Then, 7 to 8 is your necessary things which you need to do. 2 hours of weak topics, because everyone, like in all the 19 subjects, we have certain weak topics. Like in patho, we have a lot of them, but in every subject we have them. Then the subject number 1 for 5 hours, we'll have 5 hours of subject number 1. Then we have a lunch break after that for 1 hour. Then again a 5-hour slot which we have for the subject number 2, or if it's a big subject, you can carry over. Then again we are taking a break from 9 p.m. to 10:30 p.m. 1.5 hours, in which you should only give 15 minutes to eating, not a lot of eating, okay? And then lastly, the revision. You all have that query that how to do the T&D sessions, the videos, the previous year questions and all. So all that is in this 10:30 to 12:30.
So basically,
14 hours.
Basically, the moral of the story or take-home message is that you are supposed to do 2 subjects in a day.
Yeah,
5 hours and 5 hours, and then the additional 2 hours in the morning and additional 2 hours late in the evening.
yeah.
So, depending on your own preparation, there might be some weaker topics there, and I think this is especially mentioned by our faculties
Yeah.
that we are not mentioning weak subjects.
Yeah.
We are mentioning weak
Weaker
topics.
Yeah,
Yes.
topics, sorry.
Because
That's most
Obviously,
important.
obviously.
yeah,
Weaker topics.
We could-
like ma'am would be a better person to tell us that what would be the more weaker areas maybe in PSN there might be a lot of
Definitely.
areas.
Nutrition, mein we have to remember the doses of the various nutrients, daily doses. Very commonly forget those doses. The various centers or goals of the national programs, we usually forget for that. So these are the weaker topics. So I think by this time, you all must be knowing in each subject that
Staging
what-
and treatment of
Yes.
cancers.
What are the weaker-
1A,
Huh.
2A1,
Yes.
cancer cervix, 1A1, less than 3 millimeter, 1A2, 3 to 4
these are the
millimeter.
weaker
60 days, 60 दिन है, sorry याद नहीं हो रहा. 60 days, corona, cancer cervix 3B, क्या हुआ? What happened? Extension to pelvic wall, hydronephrosis आ गया cancer cervix में. कौन सा stage है? 3B. सर था अच्छा pelvic wall पे क्या? Oh, ureter is compressed, back pressure, hydronephrosis. 60 days. Remember?
Yes, same thing with breast cancer staging also, right? T1, T2, T3, T4, if you remember, my dear friends, less than 2, 2 to 5, more than 5, any size, chest wall, skin, both inflammatory, right?
Utilize.
Yes.
Utilize the time.
The lymph node staging there, mobile, fixed, internal memory, then dual combinations, the apical and axillary and internal memory, and the supraclavicular. So that is how we need to actually quickly revise these weak areas. in
And
the
say
first 2 hours.
renaplasia, metaplasia, hypertrophy, hyperplasia, glomeruloendothelial.
List will not end if I start the title. So let's
Tumor
not talk
markers
about
and all.
Tumor markers, granulosa cell tumor,
Pancreatic cancer tumor
inhibin,
marker, CA19.
granulosa cell tumor, inhibin, serous epithelial tumor, CA125,
Yeah.
choriocarcinoma, HCG, and
a lot of you. So there are 3 important things which they have asked, but I'm seeing the comments.
Yeah.
One question they have said that if I start from now on, will it be enough for me to crack this exam?
Yes, yes,
60
yes.
days are
yes.
more than
More
enough.
than enough. More than enough.
So it's a
Clear
clear-cut
cut
indication. If you see this schedule, we'll be sharing the PDF to you people. We will be sharing this PDF. You go through this PDF. We have a belief that we should have a structured plan. Until unless we do not have a structured
it
plan,
took 5 days. It took 5 days and 20 to 25 core people of MIS to design this study plan for you. Each and every moment, each and every minute has been given a proper emphasis for this study plan. Every moment matters.
I think you can revise thrice in these
Yeah,
20
yeah,
days.
yeah.
This
So
is the important
The
thing.
plan has been made in a way, ma'am, ke if 2 proper revisions and 1 quick revision you can do with this.
Yes, more than enough to pass.
And 60 days, I think this is really
Yeah.
good.
Yeah.
2
Yeah.
proper revisions and
And
1 quick
quick
revision. And these would really give a great impetus. So basically, the first 2 hours for the weak topics, then subject 1, subject 2,
And last,
and last 2
PYQs
hours.
and
Yeah.
Yeah.
The
review.
PYQs definitely
Images.
are going to be
Recent year questions.
recent year questions. And
images and
the
all,
TNVs and
telegram
all.
questions and all.
And you can utilize Miss All-in-One for recent year questions.
yeah, missed all-in-one.
Missed
And
all-in-one
really
can
thanks to all the missed
Faculties.
students and the
Yeah,
faculties for that missed all-in-one.
All the Miss
bringing out such
faculty
a
have
wonderful thing.
contributed their best for Miss
So
All-in-One.
you can use that, and that all is gonna play an important role. Second thing which everyone is asking, sir, there are so many people who are asking this, that the exam is gonna be tough.
Yeah, that is a question raised by so many students, and that is probably because looking at the history of FMG exam, I remember June 2014, which is the toughest exam in the history of FMG, where the pass percentage was 4%.
Yeah.
And then
They shifted
31st
from March.
August, yeah, they shifted from March to June.
June.
And then the
August.
June 2020 shifted to
Post-COVID.
31st August 2020.
That was also
The
the
2
toughest.
exams
Considered
had
to
been
be the-
tough. But this does not mean that it is mandatory that if the exam is getting postponed, it is bound to be tough. That is not mandatory.
Whatever may be the reason, August 2020 is considered to be the toughest exam in the history of FMG exam. Second toughest exam.
Second toughest.
But the passing percentage was 14%.
Yeah.
Last exam passing percentage was 10%.
Yeah.
So whosoever is doing, whether this is God or whosoever, even if it is a very tough exam, first of all, we will not make it tough. We will make it easy in 60 days. हम थोड़ा अच्छे से पढ़ेंगे, थोड़ा ज्यादा पढ़ेंगे,
इसलिए
जो
easy
हमने
लगेगा।
पढ़ा हुआ है उसी की अप्रोच थोड़ी ऐसी करेंगे कि वी विल अंडरस्टैंड द concepts. We will utilize these 60 days to understand the concepts also. Previously we were talking about, see, there's less time now. Don't understand the concept. If you have forgotten the concept, don't understand them. Just mug up the thing. Now you are watching the classes also.
Yeah, yeah.
You have the videos also. You are watching the classes also. So now you understand the concepts also.
Yeah.
Why to waste time here and there? In here, thing. Utilize the time.
Yeah, that's absolutely correct. I guess that we have to do the maximum utilization of whatever potential we have. Another thing, beta, always remember that results are never in our hands. What is in our hands is hard work. और एक चीज जो बहुत अच्छे से पता है बेटा, जो लोग सच्ची ईमानदारी से, शिद्दत के साथ, जी जान से मेहनत करते हैं बेटा, उनको कोई नहीं हरा सकता. तो अपने ऊपर विश्वास रखो और अपनी हिम्मत को और बढ़ाओ. और another story here is that even if it is a tough exam, suppose by chance, then also we had seen that topics are going to remain almost the same. So that is going to be very
Topics are
crucial.
repeated.
So you have to actually, when you are doing revisions of two subjects on one day, you are able to correlate one area with another area in the other subject. So I think that will give you a better preparation in understanding the concepts and in application of those concepts.
Yeah, I just want to add one thing कि आपको जो extra time मिला है here, although we had given the study plan, but I think अगर आपको ऐसा लग रहा है कि some subjects you had left earlier कि
Yeah,
आपके
yeah.
पास time नहीं था
Very-
या some topics you had left, so I can say that you can first start with those subjects जो आपको लगता था कि मैंने भाई 14 subjects ही complete करे, I was not having time to cover all the 19 subjects. So whatever the weaker areas you had left earlier, now you can start with that. Whatever the subjects you had left, you can start with that. So at least you will have a confidence that now I'm not leaving any subject, I'm not leaving any area. So that will be giving you more positivity, more confidence, and I think you will be performing much, much better in the
Otherwise,
exam.
what we were doing before, if we left some subject, we were just converging to Miss Toll in one book.
True.
And we were taking the essence from that only.
Now
We can go through the whole subject.
you can understand the concept, and you will be having more idea about that particular area.
Sir, Amit sir के लिए there are many comments. Sir, they are
क्या हुआ
thanking you.
भाई?
They are thanking you for putting up the OVG revision videos in the app. They are saying that.
Thank you. Thank you so much.
They are
God
saying-
bless you, always with you. And I hope you are all solving questions at 9 p.m. at Telegram. Today also you will get 40 questions from Upsky. Fresh questions, new questions. You will solve them in 40 minutes. I made those questions in 40 minutes today.
Wow. Great.
Towards the end, guys, in this study schedule, what we have done is, like, if you see towards the end, like, in this schedule, we have given in the start the generous hours to every subject. Now, we believe that you people were very strict into your study regime, so you people must have completed many a subjects. But if you see the start, we have given enough time for different kinds of subjects. I mean, 3-4 days we have given. So if you are strong in any particular subject, you can, utilize those days in some subjects. As Deepa ma'am said that, you have left. Let's say you have left some portion of pathology, maybe hematology. So you can do it there. I mean,
Obviously.
you can try and you can study all those leukemias over there, right? So this is how you can manage. Towards the end, after 5th, what we have done, you see that
And one more thing I would like to add what Kunal sir was saying, that this gives you a smart approach also. Because if suppose the exam was on 4th of December, what Deepa ma'am was saying that if you were leaving some subject, suppose XYZ, say suppose you were leaving psychiatry. Now, if there are 5 to 6 questions from psychiatry, this in 60 days have given you sufficient time to do that psychiatry also. So you are getting that extra question of 3 to 4 questions at least
Obviously,
Yeah.
obviously.
from there. So ultimately the game changing or the deciding thing would be what you are scoring on the final day. So this 3 to 4 from different areas, weaker areas, I think that will add value to the score.
That will be acting like as a grace marks
Yeah.
towards the final score.
Thank you so much, Anshul, Rahul, Siddharth, Harleen, Shubham, for these wonderful messages. Nitin, thank you so much. We are always with you.
Beta, there are many people who are saying that they have lost the track. That is the exact reason why we are sitting here and giving you this schedule. That's what we said, that it is, you should know what you have to do. This schedule will be shared to you. Somebody has asked where will we share the schedule. So it will be shared in the comments, in the description of this particular video. You can take it from there. And when you know what you have to do, obviously, it will act as a catalyst for you to come back to your libraries and go to your study tables and study again. Because there's only one way of passing, and that is to study.
बेटा जी वापस से आ जाओ आप स्टडी टेबल पे, राइट? और उसी फोकस के साथ, उसी शिद्दत के साथ, रुकना नहीं, थमना नहीं, हारना नहीं, लड़ना है. Keep fighting, keep grinding on a daily basis.
अगर लास्ट 5-6 days आपने रिलैक्स कर लिया होगा, so I think your battery must be more than 100% charged.
Now geared
and now
up.
you have to come up on the track.
Yeah.
और बेटा किसी की सुनानी नहीं है, मतलब ऐसा नहीं दोस्त ने ऐसा कर लिया, इसने ऐसा कर लिया, ये कुछ नहीं है. कोई साथ नहीं रहना बेटा. 20 तारीख को अकेले जाना है, अकेले वहां पे ABCD जय माता दी करना है और बाहर आ जाना. रिजल्ट भी तुम्हारा ही आएगा. सो मेक श्योर दैट यू आर नॉट गोइंग आफ्टर एनीवन. Go after this. This is very important, because eventually, what we have to do. May each one of you pass this exam. That's the whole thing.
And sorry, Kunal sir, I interrupted you at that point of time. You were telling some important thing in the last preparation days.
In the
After 5th of January.
from 5th till 5th, we have given you time for your weaker topics. From 6th, we have given you these 2 hours, because by then you'll be 2 times you'll be able to revise every subject from our side. So then afterwards you can do that. We have given you quick revision for particular subjects in a day. That in 2 hours, like if they have done pharma for 2 times, so they would know कि यार यहाँ पे mistake है, तो उसको फटाक से सुबह 2 घंटे में revise कर लिया. तो if they follow this particular thing, so as we have told them prior, that they'll be able to see things twice.
Yeah,
And
3 times, right?
and one more thing we have added in this schedule. You all have problems. Images कहाँ से देखनी है? तो बेटा images के लिए भी we have given you ample time in this, that you can see the images when you will be doing the subject, like for example derma, very important for images. Then your ortho and radio, they're again very important for the images. So when you will be doing these subjects in those 5 hours, you'll be seeing the images as well. But towards the end, again for a revision, we have put dedicated hours for the only image revision, nothing else. And your recent year questions. Last 3 times we are talking about from 2020, because the pattern of the examination has been changed from there. So it will be our advice that before 2020, those single liners, they should not be focusing much. You should be focusing only from August 2020.
Yeah,
So this
that's
is what we have done in this.
And regarding images, one more thing I would like to add, beta, because now we have got sufficient time. So the hot images, which different faculties would have told you that this image, the examiner is going to twist this image like this, and this may come in your exam. Like in surgery, I know that there might be an image either from an extradural or subdural hematoma, or maybe from pneumothorax, hemothorax, tension pneumothorax, or maybe an X-ray of intestinal obstruction, or maybe hollow viscous perforation. So it is not only the images which are there in your workbooks, but you can even go to Google for those hot images and try to look at as many images as possible on Google as well, because sometimes there are copy paste images in the exam from there.
Yeah.
So I think since we have got time,
It'll help.
Yeah.
It'll help.
Then I just want to add one more point. Okay, don't focus on identification of the images only. Just focus on the topic from where the images are.
Definitely.
Because
Absolutely.
nowadays they don't straightforward ask you identify the images. Yes, in some images they ask, but not in all. The image will be an additional clue for your clinical based question. So just from which topic that image is asked, what we say it's a hot image. So you have to focus on that particular topic. So they are not going to ask only the image. They can ask what is the diagnosis. They can ask what is the most important other investigation. They can ask the complication of that particular disease. They can ask the management also. So indirectly you are revising that particular important topic quickly along with the image.
Sundaram Chaudhary is asking, sir, anesthesia, psychiatry, ortho, सबका वीडियो बार बार देखकर हो जाएगा, ये नोट्स भी पढ़ना पड़ेगा बेटा. 60 days वीडियो भी
Notes
देख
तो
लो
पढ़ना है.
and notes भी पढ़ लो. We have time.
दीपा मैम, आपसे गूगली मांग रहे हैं PSM की. कह रहे हैं 25 क्वेश्चंस का जो वीडियो है PSM का, that was amazing. Many people have written and they are saying they want more googly
Uh,
on the PSM questions.
Thank you so much, beta. Yes, I had played a googly ball in that because I know कि you were thinking in this direction, but I know that you can stuck here. So I changed one or two words and that has changed the answer. So my purpose was for that 25 questions was that you should be clear in concept about the topics of that particular questions. ठीक है? I always say कि don't mug up the question. Don't mug up the answers. ठीक है? You have to focus on the concept and try to identify the keywords, and that's why you will be able to save yourself from these type of the fires what we see
Anshu
in the
Sharma
examination.
is saying अमित सर ऐसे ही 9 PM पे FMG का पेपर बना दो बेटा 60 days 9 PM पे क्वेश्चन सॉल्व कर दो हो सकता है पेपर ही मिल जाएगा
क्या बात
19 सब्जेक्ट्स का सर्जरी भी पैथो भी PSM सबके क्वेश्चंस एवरीवन इज posting questions everyone is giving questions they are their questions only which I am posting.
right, great.
As bachas, we all are dealing with this syllabus for next 60 days. Or ultimately, what is the purpose? Purpose is to clear our exam. And we know that for getting the success, hard work definitely plays a very important role. But along with the hard work, as I say, that always the smartly you have to play, as well as you should be having a self-confidence in yourself, and you have to do the firm determination in your mind that yes, I have to achieve the success. So you are not going to stop before achieving your goal. So these are the three very important points what we can have for our success. Your hard work definitely plays an important role, but you should be self-confident also, and you should be stay focused on your particular goal.
Yes, Siddharth, OBG revision by 23rd, definitely.
Now, as we all know, beta, the story of Ramayana. Why Rama has won the battle over the Ravan. It was not that Rama was very strong. Ravan बहुत मजबूत था, बहुत शक्तिशाली था. He was getting the blessings from the Lord Shiva कि उसे कोई नहीं मार सकता. But only the brother Vibhishan has told the secret. So the internal things can affect our success. And that internal thing is our fear, our weakness. So आपको उस weakness को capture करना है. You have to control that weakness, and then only you are going to get the success. Now, if I say that you have to fly in the sky, so if I say you can just float the flower of a rose, you cannot float or you cannot fly it. What you have to do, usko todna padega. You have to just break up in that small pieces, then only the leaves of that flower can fly. So same like, अगर आपको ऐसा लग रहा है कि बहुत आपको प्रॉब्लम हो रही है, बहुत आपको प्रॉब्लम्स फेस करनी पड़ रही है, इतना सारा एक्सर्ट करना पड़ रहा है बेटा, so if we have to fly for your success, then obviously आपको बिखरना तो पड़ेगा ही, आपको टूटना तो पड़ेगा ही, आपको स्ट्रगल तो करना ही पड़ेगा, क्योंकि जितना ज्यादा आप स्ट्रगल करोगे उतना ज्यादा you will shine like a diamond. Okay, and as you might have seen in your clinical practice, कि अगर कोई small case होता है, my surgeon is sitting next to me, and we know that अगर कोई small stitch लगाना होगा, we can give to the assistant. Even a first year, second year student को कह सकते हैं कि you can put the stitches. But अगर कोई major surgery करनी होगी, so who is going to do the major surgery? The senior person of the team will do the major surgeries. So same like you are going to get a success in this exam. So God has selected you to achieve the grand success in the exam. आपने देखा होगा ना कि मूवीज में साइड रोल्स तो न्यू कमर्स को मिल जाता है, लेकिन मेन रोल किसको मिलता है? द फेमस एक्टर्स. और उसी के कारण मूवी चलती है. सो यू आर द मेन पर्सन. गॉड हैज चूजन यू because God believes in you that you can do the hard work, you can get a success in your exam, and you will serve the society. तो इस मेहनत से डरना नहीं है, ठीक है?
I think you are going to be the most noble person of this society, and
बिल्कुल,
Deepam has
because
rightly said that.
God has selected you. और बेटा इन 60 दिनों में again you have to come on the track. सब चीजें जैसे पहले छोड़ी थी आपने 4th दिसंबर को फोकस करके, you are away from all your family contacts, away from your social media, away from your social circle. Same for the next 60 days, you have to follow the same pattern. शांति से, शिद्दत से अपनी मेहनत करते जाओ. And ultimately, when you enter in the exam, आपको चेस का गेम जीतना है, and आपको checkmate बोलना है, आपको कंप्यूटर पे क्लिक करना है, and then you are going to get the success. So, मैं तो यही कहूंगी कि भगवान ने कहा है कि खोल दे पंख मेरे, कहता है परिंदा. ये परिंदा कौन है? ये आप लोग हैं. आपकी तरफ से मैं बोल रही हूँ, अभी तो और उड़ान बाकी है. जमीन नहीं है मंजिल मेरी, अभी तो पूरा आसमान बाकी है. ये तो बेटा अभी आपका पहला स्टेप है. नाउ यू आर गोइंग टू फेस मोर एंड मोर स्टेप्स इन योर फ्यूचर लाइफ. तो अभी तो आपको बहुत ज्यादा उड़ना है. ठीक है, तो मेहनत करते रहो, ट्रैक पे बने रहो, एंड स्टे फोकस्ड टुवर्ड्स योर गोल्स.
Deepa ma'am, there's so many messages for you regarding PSM. They are really appreciating, and they are saying that you have made PSM a cakewalk, enjoyable sessions. So
Thank you so much, beta. Thank you so much. I thought ki PSM is a sleeping pill for all of you, but I tried my level best to correlate with the clinical topics because we all are the clinicians, so we can correlate the things
Nisha is
clinically.
asking गाना वो PYQ वाला.
I come first in that, man. Make them sleep in the class.
Yeah, I'm also in the same track. But yes, see, we are trying to correlate clinically. So imaginary, we are making a clinical situation. कि भाई आपने अगर पेशेंट्स नहीं भी देखे हैं, so how the patients can present to you, and उस clinical imagination से you can understand the things.
And Vineet sir, आपके लिए तीन चार चीजें हैं. There are so many people who are saying big fan, and they are saying sir, surgery को एक दिन में revise कैसे करना है? How to revise surgery in one day if they want to revise. And there was a special message which somebody has, I forgot the name because there are so many messages are coming. They are talking about the indexing of the workbook. So they have said that, the hats off, it was written that the indexing is beautiful.
Yeah, so beta, I personally feel that since you have already done surgery twice earlier, so now just keep a check at the indexing part. The general surgery, the first 6 chapters, that is a totally different story. But the bulky thing, the chapter 7, 8, 9, you just look at the first page of chapter 7, look at the first page of chapter 8, and first try to recollect what you remember in that first page of chapter 7, first page of chapter 8, and then try to correlate. Okay, इसमें ऐसा होता था, इसमें ऐसा होता था, इसमें ऐसा होता था, इसमें ऐसा होता था, so that you get a framework all around you, and then you move towards the inside chapters. So I think to be a little more broader, trauma, you can revise nicely in 1 hour 30 minutes or 1 hour 45 minutes, wounds in 20 minutes, then vascular surgery, you can do it in 50 minutes or maybe 1 hour. Then endocrine surgery, you can do again in 1 hour, the salivary glands in 30 minutes, pediatric surgery, you can do in 1.5 hours to 2 hours, adult surgery, you can do in 3.5 to 4 hours, and onco surgery, beta, just remember how we learned onco surgery, and I hope you'll be able just to recall that how we learned onco surgery. Just try to recall that. If not, then look at the revision video quickly, and you'll be able to revise the complete onco surgery in 45 minutes to 1 hour. This is what I feel.
Thank you, sir. Ma'am, somebody has written for you, just last comment here, that PSM has become modafinil for them from benzodiazepine. And somebody has wrote that please pray for us, for us.
Definitely,
So,
beta, we all are
I mean,
praying. You are always
yes.
in our prayers.
You believe it or not, but then you're always and always in our prayer.
बिकॉज बेटा ये आप लोगों के एग्जाम नहीं होते हैं, हम लोग के भी एग्जाम होते हैं. जितना पाल्पिटेशन आप लोगों को होता है, शायद उससे ज्यादा हम लोगों को होता है कि व्हाट विल बी आस्क्ड इन द एग्जाम.
Now, this consistent self-discipline and multiple revisions of our studies is the most important approach to refine our recall in the exam. This is, we are saying from day one, कि बेटा जितना रिवाइज करोगे उतना अच्छा है. और रिवाइज क्या करना है? जो तुम पहले दिन से पढ़ रहे हो, the things which you are reading from day one, that are your notes, your study source from where you have done everything. Or God has been really kind to you people, that it has postponed the exam for 45 days. I still remember that day, sir. I had a class that day, and suddenly the notification came that the exam has been preponed for 14 days. And I still remember those messages which came, and we were discussing on call that, what's going to happen. So, God, you must have prayed a lot.
कि कुछ
that something
टाइम
happens.
मिल जाता.
So God has postponed the exam for 45 days. Don't let God down. Okay? So He is there with you.
True.
We are praying. Everyone is praying for you. You are also praying. Don't let anybody down. Work hard. And consistency is always going to be key. And more times you'll revise, better will be the recall. कहीं से भी आए बेटा, टफ भी आएगा ना एग्जाम, एज सर मैम हैज सेड, इफ द एग्जाम विल बी टफ, आएगा कहाँ से बेटा? इफ द एग्जाम इज फ्रॉम यूपीएससी और जेई, बेटा हम भी सॉल्व नहीं कर पाएंगे, फिर तो दोबारा करना पड़ेगा. बट इफ द एग्जाम इज कमिंग फ्रॉम अ मेडिकल करिकुलम, then definitely, as we tell you all the time, that the content, more than enough question to get more than 200 marks will be from the notes you are reading. So just be consistent.
Here I just want to add one point. Mostly क्या होता है कि जब हम कोई सी सब्जेक्ट का रिवीजन स्टार्ट करते हैं, so we start from the topics जो हमको पसंद है.
Yeah, definitely.
Every time.
Yeah.
Every time we start from the topics which we either know or which we like. एंड एंड में आते आते वो 10% टॉपिक्स एवरी रिवीजन में छूटते हैं जो हमने पहले छोड़े थे, बिकॉज आइदर यू आर टायर्ड बाय दैट पर्टिकुलर टाइम और यू डोंट लाइक दोज टॉपिक्स. सो व्हाट आई कैन से कि जब भी आप रिवाइज करो, यू जस्ट रिवाइज इन अ अपोजिट वे, कि जो आपके फ्रेश माइंड में जो आपने पहले टॉपिक्स छोड़ दिए थे, विच वर योर वीकर एरियाज, आप उसको रिवाइज करो. क्योंकि जो आपके स्ट्रॉन्ग एरियाज हैं, अगर उसमें आपको रिवाइज भी नहीं करोगे, देन यू आर गोइंग टू गेट द आंसर फॉर दोज क्वेश्चंस. तो उनको रिवाइज करने का ज्यादा एडवांटेज नहीं है. नॉट से कि भाई मैडम ने कहा रिवाइज करने का एडवांटेज नहीं है तो रिवाइज ही नहीं करना. नो, यू स्टार्ट रिवाइजिंग फ्रॉम योर वीकर एरियाज फर्स्ट, सो in a fresh mind you can remember those areas, and in the end you will come to your strong. This is what I feel you can do in that way.
Sir, please, शैलेंद्र को आप कुछ बोलिए सर. शैलेंद्र रावत, we are reading your
Hi,
comment.
Shailen. Hi, Shailen. Thank you so much for wonderful, nice, beautiful messages. May
And
God bless you.
Pranav ने बोला है, Amit sir, one question for you, how we could be happy always, just like you, such an inspiration.
जिंदगी हैप्पीनेस इज द फीलिंग, बाहर से खुशी नहीं मिलती, खुशी अंदर से मिलती है. और खुशी बड़ी बड़ी चीजों में नहीं है, खुशी बहुत छोटी छोटी सी चीजों में है. खुश होना चाहते हो ना, इफ यू आर स्टडिंग इन द लाइब्रेरी, हेल्प समवन. अगर फेलो के पास, कलीग के पास पेन नहीं है, उसको एक पेन दे दो यार. एक कॉपी मिस कर रहा है, 2-3 पेज मिस कर रहा है, गिव इट. मैंने 3 दिन पहले टेलीग्राम पे एक पोस्ट डाला था, कैन दिस वर्ल्ड हैव अ रोटी डे? वी हैव वेरियस डे, कैन वी स्टार्ट अ रोटी डे? Dogs, animals, they don't know it require a currency to buy a roti. कुत्ता है, एक सड़क पे जा रहा है, हम चलते हैं ना, कुत्ता मांगता है रोटी, हम कहते हैं चल हट यहाँ से. कुत्ते के पता है कि 10 रुपए का नोट लगेगा एक रोटी खरीदने के लिए, दे दो यार उसको, यू विल बी हैप्पी. स्टार्ट अ रोटी डे. कोई भी एनिमल उस रोटी डे पे भूखा नहीं सोएगा कभी. सारे लोग बाहर निकल के सोचेंगे यार आज रोटी डे, आज कुत्ते को रोटी डालना है. कम से कम एक दिन पेट भर के खाना खाएंगे सारे एनिमल, खुश हो जाओगे तुम.
बेटा, many of you are saying that last time, like Saibur Rahman.
Thank you so much. Thank you so much. I am
I-
reading all the messages, but I don't want to say myself. Thank you so much. Thank you.
Last time I got 149. How can I manage? 149 आया था लास्ट टाइम. कैसे मैनेज करना है बेटा? सोचना ही नहीं है ना. लास्ट टाइम तो गया, कब का चला गया वो. सो यू शुड नॉट बी थिंकिंग अबाउट इट. फॉर सर ने जैसे बोल रहे हैं 60 days.
आई थिंक मैं यहाँ पे कह सकती हूँ कि आपने अपने क्वेश्चन पेपर से इफ यू हैड एनालाइज कि इन विच सब्जेक्ट यू हैड मेड द मिस्टेक्स, which were your weaker subjects, which were your weaker areas, so unko you can cover up first.
देखो,
So definitely this will improve your results.
Will is more important than skill. आता है हमको, पता है, but exam has been postponed, so don't feel low कि यार अभी दे देते 4 दिसंबर को तो पास हो जाते. Will power is the most important, when Ravan took Sita to Lanka and Rama was searching for her. राम सीता को ढूंढ रहे थे, रास्ते में जटायु मिला. इट विल टेक 1 minute टू टेल यू, बट अ वेरी इंपॉर्टेंट टेक होम मैसेज. जटायु ने बोला कि राम आपकी वाइफ को लेके लंका चला गया है. तो जटायु मर रहे थे, ही वॉज डाइंग. तो राम ने जटायु से कहा मैं आपकी हेल्प करता हूँ जिससे आप नहीं मरे. जटायु ने कहा नहीं, मैं अब मरना चाहता हूँ, आपसे मिल लिया, इसके बाद मेरे को जीने की इच्छा नहीं. पर क्या मैं स्वर्ग में जाऊंगा, आपके पिता वहां पर हैं दशरथ जी, मैं उनको बता दूं कि आपकी बहू को रावण लेके लंका चला गया है. राम नंगे पैर जंगल के अंदर केवल एक धनुष बाण, साथ में भाई लक्ष्मण, दोनों भाई, दोनों नंगे पैर, केवल एक एक धनुष बाण। राम का रिप्लाई सुनिए, नहीं जटायु, आप मेरे पिता को मत बताना, उनको दुख होगा। मैं लंका जाऊंगा, रावण को कुल समेत मारूंगा, और रावण जब स्वर्ग पहुंचेगा, क्योंकि मेरे हाथ मरेगा तो स्वर्ग ही पहुंचेगा, रावण जब स्वर्ग पहुंचेगा तो अपने मुंह से मेरे पिता को बताएगा। जब मेरे पिता पूछेंगे मेरे पितर ने तुझे क्यों मारा, तो रावण कहेगा मैं धोखेबाज ही नहीं हूं, महाधोखेबाज हूं, मैं कमीना नहीं हूं, मैं महाकमीना हूं। इसलिए मैं ब्राह्मण का वेश रख के आपके पुत्र के घर में गया और आपकी पत्नी को उठा के ले आया। मुझ पर कोई भी पूरी दुनिया में भरोसा मत करना, क्योंकि मैं सब जगह धोखेबाजी ही करता हूं। मैं धोखेबाज नहीं हूं, महाधोखेबाज हूं। मैं रावण खुद ये जाके बताएगा मेरे पिता को स्वर्ग में। देखिए राम की विल पावर, दिस इज द विल पावर। नंगे पैर, केवल धनुष बाण, रावण खुद बताएगा। विल पावर इज मोस्ट इंपॉर्टेंट। 60 दिन है, ये विल पावर हमारी क्या है? वी विल स्कोर 220 मार्क्स इन अवर एग्जाम, 210 मार्क्स इन अवर एग्जाम, 205 मार्क्स इन अवर एग्जाम। ये हमारी विल पावर है, हम इससे शेक नहीं होंगे। एंड वी कैन अचीव 205, वी कैन अचीव 210। अगस्त 2020 टफ क्वेश्चन पेपर। व्हाट इज दिस टफ क्वेश्चन पेपर? 60 days from now, अंडरस्टैंड द कंसेप्ट। सब कुछ पढ़ेंगे ना हम। OBG 30 questions by NB. If you get 30, we should score 29 marks out of 30. I guarantee. अगर 30 क्वेश्चन OBG में आएंगे, सब बच्चे 29 क्वेश्चन सही करके आएंगे। एक क्वेश्चन तो कहीं से भी आ सकता है, किसी भी सब्जेक्ट में। There are 19 subjects. If you get an anonymous question from one subject, you will get 19 anonymous questions. So if you get 270, 275 good questions, which are doable questions, which you can solve. And if you score 240, 235 or 250 marks out of that, is it a bad deal? Do we want to score 300 out of 300? क्या 300 में से 300 लाने वाले को मुकुट लगा के अंदर ले जाएंगे? We will feel happy with 225 beta. We will feel happy. We will score 225 or 230 in remaining 30 days. We will change the game. खेल कोई तो बदलना है। जीतने वाले कोई अलग काम नहीं करते, वो हर काम अलग तरीके से करते हैं। इन 60 दिन में थोड़ा सा अलग, थोड़ा सा अलग, थोड़ा सा अलग।
Dr. Dream, is this schedule will correlate with our missed subject-wise test schedule? Definitely, sir, it will. Definitely. Ma'am, many of them, they are saying, they are taking my name and saying, sir, you are not conveying a message to Deepa ma'am for a song. So,
Which
if
song?
Any, I mean, just 2 lines from you. They are.
Thank you.
They want.
Thank you, Khilraj. Thank you. Thank you so much.
And, ma'am, any song they are saying.
So let me think.
Yeah, okay, ma'am. So I have conveyed your messages, guys. Okay, so don't say Kunal sir is not conveying.
हैप्पी आवर्स किसके लिए?
हैप्पी आवर्स किसके लिए बताइए? हैप्पी आवर 60 days, you know, मशरूमिंग ऑफ द कंटेंट। ये भी पढ़ लो यार, ये भी पढ़ लो यार, ये भी पढ़ लो यार। हैप्पी आवर्स है, ये भी पढ़ लो, ये भी पढ़ लो। दिस इज फॉर दिस इज फॉर फ्री, दिस इज फॉर 50%, दिस इज फॉर 20। Don't be mistaken by happy hours. You are going at some place. This is happy hour 50% discount. This is not happy hour for you. This is happy hour for that person who is providing happy hour. If something is available free of cost in this world, mind my words, you are the product. You are sold out. If you get something free in this world, you are the product. You are sold out. Be careful.
Okay, and sir, this Viren Saran, अमित सर मेरे स्कूटर में पेट्रोल खत्म हो गया है, प्लीज हेल्प धक्का लगा दीजिए।
आप बिल्कुल आते हैं 9 बजे रात को मिलते हैं मिस नेक्स्ट टेलीग्राम पे, धक्का लगा रहे हैं
सर।
The road to someday leads to a town called nowhere. So, beta, as we have been discussing, that we have to be very meticulous in our approach, as Amit sir has rightly pointed out, that do not get deviated from the content, what you are focusing on. Just try to focus on that content, on the same topic. And you have to do it today, not tomorrow. Tomorrow never comes. Even today, you have to do it now, right now. Don't leave it for tomorrow. If you leave it for tomorrow, God is going to leave your result for tomorrow, right? So have that feeling, have that fire in your belly that yes, you have to do it today itself, not tomorrow. आज ही करना है. Because if you do it now, you will get another opportunity to do it once again in these 60 days. And you will be better equipped on 20th of January with more confidence in front of the computer screen.
यहाँ पे मैं एक लाइन कहना चाहूंगी कि 60 डेज पोस्टपोन्ड हो गए हैं, सो डोंट थिंक लाइक दिस, लाइक आज करे सो काल करे सो परसों, ऐसी क्या जल्दी भई अभी जीना है बरसों. नो, यू हैव टू डू दिस लाइक दिस. काल करे सो आज करे सो अब, पल में परले होएगी बहुरी करेगा कब. सो वॉट एवर यू आर सपोज टू डू इट टुडे, rather than today, do it right now.
जिसने किया कल दिन गया टल, जिसने किया परसों बीत गए बरसों, जो करेगा आज वही करेगा रात.
क्या बात है. Great.
And Vivek is asking mock test देने जरूरी है. Vivek, I know. Okay, Vivek Pathak, RB1. बेटा सारे mock देने हैं, ठीक है? I'm gonna see your marks also.
And देना ही नहीं है खाली.
Analyze.
You analyze.
Yeah,
That's a
very
very important thing.
It's very important.
कि you have to analyze your result of the mock test, कि where you had made the mistakes and you have to rectify. Because successful people are those people, either they learn from the mistakes of others. ठीक है, that phase is gone. You are now learning from your mistakes. That should be the second type of person. And these first and second are going to get the success. But the third people are, or the third category are, that they are doing the mistakes and even not learning, then definitely God also may not be able to help them. So you have to analyze your results of the mock test and you have to learn from the mistakes.
Just few days before exams, we were leaving many things, you know. This is not part of the syllabus. Many students were sending messages, sir, CA Valva, is it part of syllabus? ये FMGE में क्वेश्चन आता है क्या? बेटा 6 साल पहले भी CA Valva पे FMGE में क्वेश्चन आया था. 60 days from now, everything which we were leaving is part of syllabus now. Don't roam here and there. जितना घूमना था घूम लिए हम. एग्जाम पोस्टपोन हुआ था, सबको खुशी होती है. मेरा एग्जाम पोस्टपोन हुआ था, मैंने भी उस दिन घर पे खाना नहीं खाया था. I didn't had dinner at my home when my exam was postponed. 2-3 दिन माइंड सेट है. हम सब ह्यूमंस हैं यार. मैं भी बच्चा हूँ, मैं आज भी बच्चा हूँ, मैं आज भी स्टूडेंट हूँ. whenever I am not teaching, I am learning something. मैं कुछ सीख रहा होता हूँ. तो सबको खुशी, ह्यूमन में ना 3-4-5 दिन सबको दिल करता है घूमना चाहिए, और घूमना भी चाहिए. वी हैव राइट. लेकिन अब उस माइंडसेट से बाहर आ जाओ. एवरीथिंग विच वी वर लिविंग इज पार्ट ऑफ सिलेबस नाउ. देखो कैसे 60 दिन निकल जाएंगे. सब कुछ हमारा सिलेबस का पार्ट है. सीए वल्वा भी पढ़ना है. कोविड इन प्रेगनेंसी वी हैव टू स्टडी. वी हैव टू स्टडी कोरियन विलस सैम्पलिंग ऑल्सो. वी हैव टू स्टडी एमनियोसेंटेसिस. 5 मिनट का टॉपिक है कोरियन विलस सैम्पलिंग. 5 मिनट टॉपिक एमनियोसेंटेसिस. 5 मिनट टॉपिक स्क्रीनिंग टेस्ट फॉर डायग्नोसिस ऑफ एन्यूप्लाइडी इन फर्स्ट ट्राइमेस्टर. स्क्रीनिंग टेस्ट फॉर डायग्नोसिस ऑफ एन्यूप्लाइडी सेकेंड ट्राइमेस्टर. 5 मिनट्स टॉपिक. नोट्स में भी हमने 15 मिनट्स में कंप्लीट कर दिया. रिवाइज भी हम बड़ा क्विकली कर लेंगे. क्यों छोड़ना. एवरीथिंग इज पार्ट ऑफ सिलेबस. जो भी हम छोड़ रहे थे बेटा 60 दिन पूरा स्टडी प्लान शेयर किया है. मॉर्निंग सब्जेक्ट्स, इवनिंग सब्जेक्ट्स, बीच में ब्रेक है, सारा इनकॉर्पोरेट कर लो. कुछ भी नहीं छोड़ेंगे. 225 चाहिए, 230 चाहिए. बिल्कुल.
मैं यहाँ पे एक चीज कहूंगी. अगर आपको लग रहा है कि हमारी जो एडवाइस है आपको ओवरडोज हो रही है, सो मैं 2 लाइन बोलती हूँ. जिंदगी एक सफर है सुहाना, यहाँ कल क्या हो किसने जाना. हंसते गाते यहाँ से गुजर, दुनिया की तू परवाह न कर, मुस्कुराते हुए दिन बिताना. यहाँ कल क्या हो किसने जाना.
Only 45 days. Exam has been postponed only for 45 days. If a astrologer comes and says your marriage is postponed for 3 years, oh, 3 साल शादी नहीं होगी तुम्हारी. बच गए. Only 45 days. सीख ली अदा जिसने गम में मुस्कुराने की, उसको क्या मिटाएंगी गर्दिशें जमाने की. ये गम है या खुशी है, ये हमारा माइंडसेट है. 45 डेज एक्स्ट्रा हमको केवल मुस्कुराना है.
बहुत बढ़िया.
So the way by which Amit sir and Vineet sir adopt that God mode of revision with closed eyes. Please share the technique of getting these workbook word to word. So
बिना वर्कबुक पढ़े. Thank you so much. Thank you so much.
Beta, if you can do it now, without looking at the workbook, if you can revise word to word, that would be the best thing. I remember,
You are looking in the workbook. We are looking in your eyes.
beta, we would really want all of them. I remember my first terminal exam in pathology when I was in late second year, or you can say early third year. So I remember I really got frustrated with the marks which I got in pharmacology first terminal. And then I took a pledge and I promised my father also that I'll do it in the first terminal of pathology. And I remember I was able to do that whole general pathology. I was able to write without looking at the book on the wall in front of my room in the hostel at night with a pencil, the entire general pathology. So I was able to do it, and we would really like all of them that you have got enough time, beta. So now your preparation should also be such that you should be able to reproduce and reciprocate everything out there.
जिंदगी में कब कहाँ कौन सी चीज हेल्प कर जाती है पता नहीं. वो रॉबिन से लिखी हुई लाइंस इन हॉस्टल रूम हेल्प इन सर्जरी लाइक एनीथिंग इन द फॉर्म ऑफ रसगुल्ला. वही लिखी हुई लाइन है सर्जरी में रसगुल्ला बन गई. समझ रहे हो ना?
मैं आई कैन ऐड वन मोर पॉइंट कि आप कैसे अपना वर्कबुक रिवाइज मतलब याद रख सकते हो. जितना यू विल बी एक्सप्लेनिंग. सो सपोज अगर आपका 4-5 फ्रेंड्स का एक स्टडी ग्रुप है एंड यू नो दैट यू आर कॉन्फिडेंट और यू आर एक्सपर्ट इन वन टॉपिक और आपका कलीग जो है वो उसमें वीक है. सो आपको ना अपना रफ कॉपी वेस्ट करना है ना अपना पेन वेस्ट करना है. आप दूसरे का रफ कॉपी लो, दूसरे का पेन लो एंड यू ट्राई टू एक्सप्लेन. सो या उसकी एम्प्टी वर्कबुक लो बिकॉज यू ऑल आर डिमांडिंग द रिटर्न द फिल्ड वर्कबुक्स. क्यों चाहिए? आप दूसरे की को लाओ, अपनी एम्प्टी वर्कबुक दो एंड यू गो ऑन राइटिंग इन दैट. तो आपका रिविजन होगा विदाउट वेस्टिंग अ सिंगल पेनी इन योर 5 रुपी और 10 रुपी पेन ऑल्सो. दूसरे का जो है वो वर्कबुक भी फिल हो जाएगी, आपका रिवीजन हो जाएगा. सो जितना आप दूसरे को एक्सप्लेन करोगे यू विल नेवर फॉरगेट दैट थिंग. सो ट्राई टू एक्सप्लेन. और आई कैन से आपका जब भी फ्री टाइम, जैसे वी हैड गिवन यू द लेजर टाइम ऑफ 1 आवर इन द मॉर्निंग, 1 आवर इन द इवनिंग. सो आप अपने फ्रेंड्स ग्रुप में आप अपना डिनर कर रहे हो, लंच कर रहे हो, यू कैन डिसाइड ओके दिस टॉपिक वी आर स्टडिंग. सो उसपे से यू कैन डिस्कस द क्वेश्चंस लाइक एन एक्सटेम्पर. द वन विल बी आस्किंग फ्यू क्वेश्चंस. So you have to answer. So quickly you can ask from any areas. So इसमें आपका brain जो है वो energy, we can say the charge हो जाएगा and what is required in the examination. कि आपको पता नहीं है कि from which topic the subject, this question is subject even. The question is coming. First could be an anatomy question. Second could be the surgery question. Third could be the derma question. Then could be the OBG question. So आपको first of all recall करना है कि कौन सा subject का है, फिर उसके बाद कौन सा topic का है, कौन सा page का है. So in that particular rapid fire question, you are developing this habit. So it will help in your time management also. So by this way also you can remember by explaining to the others. So आपका जो difficult topic होगा वो आपका simplest और strongest topic बन सकता है. This you can also follow.
So they're asking, is there any crash course for the last 60 days? Anything from the website?
For any TNDs?
We have.
Yeah, you can, if somebody wish to join us,
Yeah.
you can join the TNDs.
TNDs we are providing, and they're starting from this
30th.
just after
30th.
yes,
30th of November.
the series of test and discussion.
Yeah, there would be revisions and test discussions there.
वीरेंद्र श्रवण, कुणाल सर उम्र निकलती जा रही है, एमसीआई निकल नहीं रहा है, खुद की शादी की टेंशन है, सिस्टर की शादी की भी टेंशन है, क्या करूं सर?
ये करो जो सामने लिखा है. अगर ऐसा पाना चाहते हो जो पहले कभी ना पाया हो, तो कुछ ऐसा करना पड़ेगा जो पहले कभी ना किया हो. पहले कभी एफएमजी एग्जाम पास किया क्या? नहीं किया. सचिन तेंदुलकर ने अपनी पहली सेंचुरी मारने से पहले कोई सेंचुरी मारी थी क्या? नहीं मारी. He did not score any century before his first century. अमिताभ बच्चन ने अपनी पहली हिट फिल्म देने से पहले कोई हिट दी थी क्या? There were 12 flop films in a row. And Amitabh Bachchan has written in the autobiography, to receive 21,000 rupees from Manmohan Desai from a flop film, he roamed around. Manmohan Desai, he went to his home for 21 times. and Janjeer made him a star overnight. This will happen to you this time on 20th of January. In these 60 days, just change the game. Whatever you are studying, study with utmost concentration and come to Miss Next Telegram at 9 p.m. Read all in one missed book if you didn't study at that time.
Great.
जो चले थे अकेले उनके पीछे आज मेले हैं. जिन्होंने अपनी जिंदगी की शुरुआत अकेले की थी उनके पीछे आज मेले हैं. जो करते रहे इंतजार, जो घूमते रहे उधर उधर, उनकी जिंदगी में आज भी झमेले हैं. तो घूमते नहीं रहना इधर उधर. हैप्पी आवर्स, दिस इज फ्री, दिस इज डिस्काउंट. जस्ट चिड़िया की आंख की तरह टारगेट. And we have given you the target. Those who have studied properly, they have to just revise the content. Those who didn't study on any platform, they will utilize Missed All-in-One book and they will solve questions at Missed Next Telegram group at 9 p.m. daily. हर कामयाबी पर, वाह क्या बात
बढ़िया
लिखी है.
लिखा हुआ है. मेरे ख्याल हम सारे बच्चों को मोटिवेट करते हैं इससे.
बिल्कुल. हर कामयाबी पर तुम्हारा नाम होगा, हर कदम पर तुमको सलाम होगा. डटकर मुश्किलों का सामना करना है दोस्त, एक दिन वक्त भी तेरा गुलाम. डटकर. And this is the information which we just shared. We are posting high yield expected questions daily on Miss Next Telegram group, mostly at 9 p.m. Utilize them, make the best use of them.
That's very important actually. Every day you are getting, because everyone has a problem in see, questions are available all throughout.
Yeah.
There are multiple things. We all are on Telegram. You can see the questions here and there, but authentic questions with right answers.
Faculty questions,
Faculty
respective
questions,
faculty.
yeah.
Pathology questions, Kunal sir question. Surgery question, Vineet sir question. PSM question, Deepa ma'am question.
Because
all 19
every day around 10 p.m. we are getting more than 100 messages ki ma'am, what is the correct answer for this question?
Yeah.
Because they see the question somewhere
And we are reciprocating.
they might be having a wrong answer by mistake,
Yeah.
and they want to confirm. So more than 100 questions daily I am getting after 10 p.m. ki ma'am, iska correct answer kya hai? So whatever is written in your workbook, what has been taught by the faculty, just focus on them. If you are getting some different answer, just skip that and keep in mind that whatever you had been taught, that is the correct answer.
Right. मंजिल भी सर झुका देगी, मंजिल भी सर झुका देगी जब दमदार तेरी तैयारी होगी. मुट्ठी में होगा तेरा मुकद्दर जब वर्कबुक संग तेरी यारी होगी. इन 60 दिन में वर्कबुक के साथ यारी, वर्कबुक के साथ यारी, वर्कबुक के साथ यारी.
I think you can do the engagement with your workbook, and or you can do the marriage. Here I just remember the one quote from my professor. Medicine में professor थे, and on the day of joining the PG course, he used to say, especially to the girls, कि you are married to the department for next 3 years. It means कि अगर आपने कभी छुट्टी मांगी तो कहते थे कहाँ जाना है, कोई कहता था घर जाना है. कौन सा घर जाना है, ये तुम्हारा घर है. सो ये से कि यू आर मैरिड टू द डिपार्टमेंट फॉर द नेक्स्ट 3 years. और अगर उन्हें पता चल जाता था कि किसी लड़की की शादी हुई है मतलब कि इन द नेक्स्ट ईयर शी इज गोइंग टू टेक अ मोर लीव्स, एंड ही इंटेंशनली मेक हर टू फेल इन द एग्जाम. तो चुपचाप जो है वो बच्चे शादी करते थे. आई स्टिल रिमेम्बर वन ऑफ माई सीनियर गॉट मैरिड ऑन द संडे, और संडे में आफ्टरनून में उनका जो है वो मैरिज था, लंच था, इवनिंग दे एंजॉयड, एंड द नेक्स्ट डे मंडे शी वाज इन द डिपार्टमेंट. हो आपकी कल शादी हुई और आज आ गए. तो दैट वाज द रीजन.
सबसे ज्यादा डर क्यों लगता था शादी से? उनको डर लगता था इसका यूपीटी कब पॉजिटिव आ गया, ये मैटरनिटी लीव पे गई, पूरा वार्ड बैठ जाएगा. यूरिन प्रेगनेंसी टेस्ट, डोंट लाई.
Somebody was asking the mock breakup subject wise, so that will not be there. You'll get mock 1 and mock 2 separate numbers.
I can just quickly tell them that in mock test, paper 1 and paper 2, paper 1, Anat Physio Biochem 17 questions each, Patho Pharma Micro 13 questions each, Forensic 10 questions, PSM 30 questions. 20 questions can be from any other clinical subjects, maybe from ENT, ophtha, medicine, surgery, gynae, pedia, ortho, or anything. While paper 2 of mock test will be having medicine, 33, surgery 32, obs gynae 30, ENT ortho 15 each, pediatrics 15, orthopedics 5, dermatology 5, psychiatry 5, radiology 10, and anesthesia 5. This is going to be the breakup for paper 2 of mock.
Yeah, and for Telegram group, they were asking the link, so we have posted the link
In the description.
We have already posted the link
Posted.
in the chat.
Okay.
We will also be posting the link in the description
Yeah.
of this video.
Great.
Then,
Bacho, we discussed the study plan. We discussed everything. Now just put your right hand on heart and say, Aho, 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 and wish you all the best.
All the best.
All the best.
Keep that fire in the belly. पानी में आग लगानी है. लगा के रहेंगे.
Aho, Aho, Aho.
All the best.
beta हार नहीं मानना है. All the PDF and everything will be in the group. Everyone is praying for you. You keep hustling. मेहनत नहीं छोड़नी है बेटा. मेहनत नहीं छोड़नी है. ठीक है?
Bye-bye.
We'll be in touch. Bye bye.
Bye.